Brentuximab is a very exciting molecule. Of course, it's FDA approved right now, but as is the case with so many things, once the drug gets FDA approved, there's still so much to learn about it. In the case of Brentuximab, the trials at this meeting, and there are two very exciting trials being reported, and we were fortunate enough to be part of each of those trials. The first trial is a trial called the AETHERA trial. The AETHERA, that's ATHERA trial, is a trial which examined the role of Brentuximab given, if you will, preventatively after autologous stem cell transplants in Hodgkin lymphoma. By way of background, when Brentuximab was FDA approved, it was approved for people who had had their Hodgkin lymphoma relapse after an autologous stem cell transplant. And so the thought was, well, I wonder if we should be using this drug preemptively in people who have had stem cell transplants. So a large international trial was conducted, and we were fortunate enough again to be part of the trial, whereby patients who underwent autologous stem cell transplants were randomized with the flip of a coin, if you will, to receive either a placebo, which was the standard of care, or to receive Brentuximab. And so that trial is being reported at this meeting. It's a very exciting trial, and because it hasn't been reported yet, I can't divulge too many of the details regarding it, but stay tuned. I think it's going to change our standard of care, if you will. The second trial being reported is a little bit earlier. So again, the question is, we have this molecule called Brentuximab that we're using after stem cell transplants. What if we used it before stem cell transplants when people have their very first relapse? And so in this trial, two medications were combined to treat Hodgkin lymphoma. One, Brentuximab, the other, a drug called bendamustine. And that trial will be reported at one of the oral presentations at the meeting this year. And 48 patients were enrolled, and what we've learned is that the regimen is extremely effective, meaning that it proves to very high, heretofore unseen levels of responses in relapsed Hodgkin lymphoma. But a word of caution, the regimen had some side effects that were fairly significant that needed to be addressed during the conduct of the study. And so, as is the case with so many things, a good idea is out there. I think it's a really hopeful, really good regimen, but we probably need to fine-tune a little bit how we do it before it becomes ready for prime time. But again, two very exciting studies.